Hello, thanks a lot for joining me today. Once again, I'm Gerald Massa. I'm a health educator. I give pregnancy solutions, I give pregnancy advice, and thanks a lot for joining me today on this channel. We are going to talk about one thing that has been asked a lot, and this is what are the causes of lower abdominal pain in pregnancy. Without further ado, we shall go to our first point, and the first point we are going to look at is all pregnant mothers are supposed to at least not experience pain. But if at all we have a pregnant mother complaining of pain, then there could be something happening. Probably there could be an infection. When we talk of infections, we are specifically talking about UTIs. We are also talking about sexually transmitted infections. We may not really be able to know what exactly is causing the pain, what type of infection is happening, until we do a test. When we talk of tests, there are many tests that can be done. When you are a pregnant mother out there and you are having abdominal pain, please don't sit at home. I will advise you need to go to hospital, and then they do some checkups on you. The specific tests that will be done include the urine analysis test. When we talk of urine analysis test, they will analyze your urine in detail. A whole picture will be given of how your urine is appearing or how it is looking by the look of the eyes. And this is normally on the report you will see something put called macroscopically. Macroscopically is how are you seeing the urine in the container. Ideally, normal urine is supposed to be colorless, but if your urine is not colorless and it is actually maybe yellow, it is having white particles, then there could be something happening. You don't need to worry. You actually have to see your doctor, and your doctor will tell you, your doctor will manage you very well. The other part we look at when we are talking about the urine analysis test, we actually look at it biochemically or under biochemistry analysis. A whole picture will be given of your leukocytes or white blood cells, your acidity in the urine, the pH of your urine. Also, they will look for pus cells and even epithelial cells. Your lab technician will document everything, and your doctor will tell you what needs to be done. In summary, if at all you have low abdominal pain and you're pregnant, there could be something happening. And this something, we are talking about pain mostly. Pain could be a sign that there's an infection. So please, if you're pregnant and you're having low abdominal pain, go to hospital. They will check your urine, and whatever comes out of the results, they will advise you, your doctors will advise you on what to do. Next point, next cause of low abdominal pain in pregnancy is round ligament pain. We know that ideally before a woman conceives, her uterus used to be small in size, but after fertilization has taken place and pregnancy is happening, there are changes that are going to be experienced. The changes include an expansion, an enlargement of the uterus, and specifically as it is expanding, it presses against the surrounding structures. So you may be feeling lower abdominal pain due to the increasing size of the round ligament. You don't need to worry if this pain persists despite taking over-the-counter drugs, painkillers like paracetamol, and you've tried that and the pain increases. Please don't stay at home. Go to hospital, come to hospital, and they will do checkups on you. And as I said, I always insist on checkups and investigations in hospital, in the laboratory, your doctor assessing you, because without doing checkups, you may assume. We normally get cases of mothers, pregnant mothers, taking herbs for pain. Herbs or home-based remedies, I would really say in pregnancy, you need to be careful. Please, before you take any home remedy, before you take any herb, make sure that you see your doctor and let your doctor assess you, and your doctor will tell you what needs to be done. Avoid self-medication. After you have reached hospital and they've assessed you, they will be able to tell you what needs to be done, and of course the doctor will decide whether the pain is due to an infection or due to some other cause which needs to be investigated. Please do not self-medicate. Next cause of low abdominal pain in pregnancy is overworking. Pregnant mothers tend to overwork. I will not say that mothers who are pregnant should not work. No, they're supposed to work. They're supposed to do their home activities. They are supposed to do the washing. But please just make sure that you do this in moderation. Everything has to be moderated. You could actually get some support, some help from a friend, from maybe even like your partner. We always advise that partners need to be involved in the activities at home. So please, if you are a man and you've not been giving your partner support at this moment when she's pregnant, please, you need to really keep it real and please support your partner, because at this particular incidence in her life, at this particular part in her life, her body is undergoing changes. There are lots of hormones pouring in the body, and these are causing issues. There are lots of changes. The uterus is expanding. So support of the male partner is very important. I'm advising all male partners, please support your partners in home activities. The main reason I'm insisting on this is that we get cases of women, cases of mothers coming in, they are pregnant, you do ultrasound scans, you realize there are changes in the heartbeat, there are changes in the baby's heart is having issues, the baby's position is actually not okay, and when you try to sit down with the mother and you counsel her, she tells you she works a lot. Please, male partners, support your wives, and everything will be okay. The period of pregnancy is supposed to be a period of happiness. Pregnant mothers who experience pain, which is not having a cause, in most cases, when you sit down as a doctor, as a clinician, and you sit down and talk with this pregnant mother, she will tell you the truth. Stress is among the causes of body pains, low abdominal pain. And how does this happen? When a woman is stressed, there are changes that go on in her body, and the changes we are talking about here include, number one, there is release of cortisol. Cortisol is a stress hormone. Surging or releasing of cortisol in the body brings about actually effects that are not so good, in such a way that a woman will be anxious, a woman will begin feeling uncomfortable. She may actually talk of pain, but when it is really something so big. So in summary, please make sure that you manage stress. How do you manage stress when you're pregnant? We advise that, please, number one, talk about stress. Talk about it with your partner. You could actually get a trusted friend. You talk about it with them. Talk to your religious leaders. Talk to your family members. You can even talk to your doctors. It means a lot when we are going through issues and we talk about it with people. Thanks a lot, my friend. Remember to like and subscribe to my channel, Pregnancy Solutions with Gerald Massa. I'm a health educator. I give pregnancy solutions with an experience of over 11 years. I'm coming in here today and I'm saying, please make sure that you don't stay at home if you are having a particular issue. Let's say you are having pains that are not explainable. Next cause of low abdominal pain in pregnancy is ectopic pregnancy. Ectopic pregnancy simply means a pregnancy that is outside the uterus. We call it actually extra-uterine pregnancy. Ideally, after fertilization, the egg is supposed to move and actually go to the uterus. It attaches itself on the uterine wall, and then it begins growing until the 9 months are over. But actually for ectopic pregnancy to happen, the egg that was traveling very well down to the endometrium or to the uterine wall, it gets blocked along the way. It gets blocked in the fallopian tubes. When an egg gets blocked in the fallopian tubes, then it begins growing in the fallopian tube. We call that an ectopic pregnancy. So when you are pregnant, you've done the HCG test, the urine tests, even the blood tests, and the doctors have told you that you are pregnant, and yet there's this pain that is not coming down. There's this pain that is acute. Please don't start home. Just head to hospital. They will do all the checkups, and they will do even actually an ultrasound scan. The best checkup for to discover that a woman is having an ectopic pregnancy, we advise that she does an ultrasound scan. You may not know the cause of the abdominal pain without going to hospital. So as I said, just make sure that you work hand in hand with your clinicians, with your doctors, and then all these cases can be managed. The next cause of low abdominal pain in pregnancy could be an indication, or it could be due to a miscarriage that is going to happen. Miscarriage is any baby that comes out before 20 weeks. I mean, a pregnancy that does not proceed despite a mother not doing anything dangerous, like maybe an abortion, but the pregnancy just comes out. Then it could be among the causes. So when we delay, when a woman delays at home and she does not go to hospital very fast, probably medication or probably treatment would have been done in hospital, but because of delay, we get many women delaying. She takes a whole week, she takes days, she takes, actually a woman is bleeding, but she takes a whole month, actually not a whole month, she takes like 1 week, 2 weeks bleeding, and she's pregnant. That is bad. You're risking your baby, you're risking your life. Make sure that you go to hospital immediately whenever you get any abdominal pains. Thanks a lot, my friend, and remember to ask me all your questions down below in the comments. I will answer all your questions. I will make it a point to answer all your questions. Ask me anything regarding pregnancy, and we shall have a discussion. It is really so good to talk to you. It's really so good to get people appreciating and saying that yes, we got the best advice and now the pregnancy is normal. This lesson has been about lower abdominal pain in pregnancy, and this is a summary. We said that the commonest cause of lower abdominal pain is it could be due to an infection. Infections could be UTIs. The other is it could be due to round ligament pain, specifically due to the expansion of the uterus. The other cause of low abdominal pain is it could be an ectopic pregnancy, it could be a miscarriage, or it could also be stress related. Have yourself a fantastic day, and please remember to hit the bell for notifications. Whenever I upload a video, you will be the first to get the video. Join me on Facebook, join me on YouTube. YouTube, you put in pregnancy solutions with Gerald Massa, actually hashtag that is pregnancy solutions with Gerald Massa, and you will be able to enjoy most of the lots of videos I've put up. I talk about anything. I talk about all the things related to pregnancy. If you are new, if you are a new mother, you've just got pregnant and you want to know how really you're supposed to go through the 9 months very well, then this is the place to be. Remember to hit the bell for notifications, like and subscribe. You will be the best, and remember, you're in the right place. Pregnancy Solutions with Gerald Massa is the channel. Have yourself a fantastic day, and bye-bye. God bless you. Bye-bye.